Do you know that more than 20 million people in the United States may have some level of kidney disease, and many of them don't even know it? Kidney disease is a serious condition that can affect your heart, bones, immune system, and even your brain. It can also lead to kidney failure, which requires dialysis or a transplant to survive. But did you know that some of your daily habits you do every day without thinking can be damaging your kidneys without you knowing about it? In this video, we will reveal 10 daily habits that can damage your kidneys and how to stop them before it's too late. So, without further ado, let's get started. Number 1. Taking too many painkillers. A lot of people use over-the-counter painkillers, like NSAIDs and analgesics, to ease their pain. But these drugs can severely harm your kidneys, especially if you have kidney disease or take them a lot or in high doses. The National Kidney Foundation says that NSAIDs can lower the blood flow to the kidneys and cause inflammation and scarring in the kidney tissue. Analgesics, like acetaminophen and aspirin, can also damage your kidneys if you take them too often or in large amounts. So what can you do to protect your kidneys from painkillers? The best thing is to use them as little as possible and never go over the recommended dose. If you have chronic pain, talk to your doctor about other ways to deal with it, like physical therapy, acupuncture, or meditation. Number 2. Eating too much salt. Salt is very important for your body. It helps to maintain fluid balance and nerve and muscle function. But too much of it can be very bad for your kidneys. That is because salt has sodium, which can raise your blood pressure and make your kidneys work harder to get rid of the extra fluid and sodium from your body. High blood pressure can damage the tiny blood vessels in your kidneys and reduce their ability to filter your blood. In fact, it is one of the main causes of kidney damage and kidney failure. So, how much salt is too much? The American Heart Association says you should limit your sodium intake to no more than 2,300 milligrams per day, which is about 1 teaspoon of salt. But most people eat way more than that, mostly from processed foods that are high in sodium, like canned soups, frozen meals, snacks, sauces, and condiments. To cut down on salt, try to eat more fresh fruits and veggies. Cook your own food from scratch using herbs and spices instead of salt, and read nutrition labels carefully when buying packaged foods. Number 3. Ignoring urination urges. Do you ever hold your pee when you are busy or don't have a bathroom nearby? If you do, you may be putting your kidneys at risk. When you ignore your urination urges, you are letting urine stay longer in your bladder, which can make bacteria grow and lead to urinary tract infections. UTIs can be painful and annoying, and if you don't treat them, they can spread to your kidneys and cause serious damage. So, what can you do to prevent UTIs and protect your kidneys? The best thing is to listen to your body and go to the bathroom when you need to. Don't hold your pee for more than 4 hours, and try to empty your bladder completely every time you pee. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Not getting enough sleep. Sleep is essential for your health and well-being. But did you know that sleep also affects your kidney health? Your kidneys follow a circadian rhythm, or a natural 24-hour cycle that regulates their function and activity. When you sleep, your kidneys reduce their workload and rest. When you wake up, your kidneys resume their normal function and filter more blood. This cycle helps your kidneys maintain their efficiency and balance. But when you don't get enough sleep, your circadian rhythm is disrupted, and your kidneys can't perform their job properly. According to a study published in the Journal of the American Society of Nephrology, people who slept less than 5 hours per night had a 65% higher risk of developing kidney disease than those who slept 7 to 8 hours per night. Another study found that people who slept more than 9 hours per night also had a higher risk of kidney disease, suggesting that both too little and too much sleep can be harmful. The recommended amount of sleep for adults is 7 to 9 hours per night. To improve your sleep quality and quantity, try to follow a regular sleep schedule. Avoid caffeine, alcohol, nicotine, and heavy meals before bed. Limit screen time and exposure to bright light at night. Create a comfortable and dark sleeping environment, and practice relaxation techniques such as meditation, yoga, or breathing exercises. Number 5. Eating lots of meat. Protein is a very good nutrient for your body, but too much animal protein can be bad for your kidneys. Animal protein makes a lot of acid in the blood that can hurt the kidneys and cause acidosis, which is a condition where kidneys can't get rid of acid fast enough. This can lead to kidney stones, bone loss, muscle wasting, and chronic kidney disease. So, how much protein do you need? Well, the dietary reference intake for protein is 0.8 grams per kilogram of body weight per day for adults. This means that an average person who weighs 70 kilograms or 154 pounds needs about 56 grams of protein per day. But this amount may change depending on your age, activity level, health status, and personal preferences. To keep your protein intake balanced and moderate, try to eat more plant-based sources of protein in your diet, like beans, lentils, nuts, seeds, tofu, and quinoa. These foods are not only high in protein, but also low in acid and high in fiber and antioxidants. Number 6. Not drinking enough water. Water is essential for life and for your kidneys. Water helps your kidneys flush out toxins and waste products from your body. Without enough water, these waste products can build up and cause problems like kidney stones and chronic kidney disease. In fact, drinking plenty of water is one of the best ways to avoid kidney problems and keep them working well. So, how much water do you need? The amount of water you need depends on many factors, such as your age, weight, activity level, climate, and health conditions. A general rule of thumb is to drink at least 1.5 to 2 liters of water per day. However, you may need more or less depending on your individual needs. To stay hydrated, drink water throughout the day, especially before, during, and after exercise or when you feel thirsty. You can also drink other fluids, such as herbal teas, juices, or soups, but avoid drinks that have caffeine, alcohol, or sugar, as they can dehydrate you and harm your kidneys. Number 7. Eating processed foods. Processed foods are foods that have been altered from their natural state, usually by adding salt, sugar, fat, preservatives, or artificial flavors and colors. They are convenient and tasty, but they are also very bad for your kidneys. That is because processed foods are high in sodium and phosphorus, two minerals that can cause high blood pressure and kidney stones if consumed in excess. High blood pressure puts a strain on your kidneys, while kidney stones are painful deposits of minerals that form in your urinary tract. According to a study published in the American Journal of Kidney Diseases, people who ate more processed foods had higher levels of phosphorus in their blood, which can lead to kidney damage over time. So what can you do to avoid processed foods? Try to eat more fresh fruits and vegetables, whole grains, lean proteins, and healthy fats. Cook your own meals at home as much as possible, and use herbs and spices instead of salt to flavor your food. Read the nutrition labels on packaged foods and choose low sodium and low phosphorus options. Number 8. Not exercising enough. Exercise helps you maintain a healthy weight, which reduces the risk of obesity and diabetes, two of the leading causes of kidney disease. Exercise also helps lower blood pressure, which protects your kidneys from damage. According to a study published in the Journal of the American Society of Nephrology, people who exercised regularly had a significantly lower risk of developing kidney disease than those who did not. The recommended amount of exercise for adults is at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week. You can also do muscle strengthening exercises at least twice a week. Number 9. Smoking. Smoking is one of the worst habits you can have for your health in general, but especially for your kidneys. Smoking damages your blood vessels, which reduces the blood flow to your kidneys. This can impair their ability to function properly and filter out waste and toxins. Smoking also increases your risk of developing kidney cancer, one of the most common types of cancer. According to a study published in the Journal of the American Society of Nephrology, smokers had a 60% higher risk of developing kidney failure than non-smokers. So the most important thing here is to stop smoking as soon as possible. Remember that quitting smoking is not only good for your kidneys, but also for your lungs, heart, brain, skin, teeth, and overall well-being. Number 10. Drinking too much alcohol. Alcohol is a diuretic, which means it makes you urinate more often. This can dehydrate you and make your kidneys work harder to maintain the fluid balance in your body. Alcohol also affects the liver, which produces a substance called urea that is filtered by the kidneys. When you drink too much alcohol, your liver produces more urea than your kidneys can handle, which can cause kidney damage. So what can you do to limit your alcohol intake? The recommended limit for alcohol consumption is no more than 1 drink per day for women and 2 drinks per day for men. If you drink alcohol, drink it slowly and with food, and alternate with water or other non-alcoholic beverages. Avoid drinking on an empty stomach or when you are thirsty or tired. Hey viewers, in our first video, we talked about 10 daily habits that are destroying your kidneys, such as taking too many painkillers, not getting enough sleep, eating too much salt, drinking too much alcohol, and more. If you haven't watched that video yet, make sure to check it out after this one. It was a huge hit and got more than 3.7 million views. But did you know that there are more surprising daily habits that are severely harming your kidneys and you are not aware of? In this video, we will reveal 10 more daily habits that are damaging your kidneys and how to avoid them. These habits are not as obvious as the ones we discussed before. But trust me, the majority of us have them, and they are equally important to know and change. Many of them will surprise you, so keep watching until the end to learn about all of them. So, without further ado, let's get started. Number 1. Taking herbal supplements. Do you like herbal supplements? Many people use them to improve their health and well-being, but did you know that some of them can actually harm your kidneys? Some herbal supplements have aristolactic acid, which is a known kidney toxin. Aristolactic acid can cause progressive interstitial nephritis, which is inflammation and scarring of the kidney tissue. It can also increase the risk of urothelial cancer, which is a type of bladder cancer. Other herbal supplements that can harm your kidneys include those that have potassium, phosphorus, or herbs that act like water pills. So, does this mean that all herbal supplements are bad for your kidneys? Well, not necessarily. Some herbal medicines can actually have beneficial effects on kidney function and chronic kidney disease progression. For example, in a recent study done in 2020, researchers found that participants who took an herbal supplement containing astragalus, salvia, and rhubarb for 12 weeks had improved kidney function and reduced proteinuria, or protein in the urine, by about 30%. So, to get the benefits and avoid these risks, read the labels carefully and avoid herbal supplements that contain aristolactic acid, potassium, phosphorus, or herbs that act like water pills. And always consult your doctor, dietitian, or pharmacist before taking any herbal supplements, especially if you have kidney disease or other medical conditions. Number 2. Drinking too much coffee. Do you love coffee? If you do, you are not alone. Millions of people around the world enjoy a cup of joe every morning to start their day. But unfortunately, your favorite drink may have some hidden risks for your kidney health. According to a recent study, people who have a specific genetic variant that makes them metabolize caffeine slowly are 3 times more likely to develop kidney dysfunction than those who metabolize caffeine faster. This genetic variant is present in about half of the population, so you may not even know if you have it or not. The researchers suggested that this may explain why some previous studies have shown conflicting results about the effects of coffee on kidney health. But don't worry, coffee is not all bad. In fact, some studies have shown that coffee can have some benefits for your kidney health too. For example, A study by Johns Hopkins Medicine researchers found that consuming at least 1 cup of coffee a day can reduce the risk of acute kidney injury by 15%. So, what can you do here? Well, coffee can be both good and bad for your kidneys, depending on how much you drink and how fast you metabolize it. However, the best advice is to limit your intake to no more than 2 cups a day, especially if you have high blood pressure, diabetes, or a family history of kidney disease. Number 3. Being stressed all the time. Stress is normal, and your body has a natural way of dealing with it. You may have heard of the fight or flight response, which is when your body releases hormones and chemicals that increase your heart rate, blood pressure, breathing, and blood sugar levels. This helps you cope with immediate dangers or challenges, but it can also have many negative effects on your health if it lasts too long or happens too often. According to the National Kidney Foundation, one of the negative effects of stress is that it can damage your kidneys. Your kidneys are the blood filtering units of your body, and they are very sensitive to changes in blood pressure and blood sugar levels. High blood pressure and high blood sugar can put extra strain or burden on your kidneys and make them work harder than they should. This can lead to kidney damage and increase your risk of developing kidney disease. In fact, in a recent study done in 2020, researchers found that participants who practiced mindfulness meditation for 8 weeks had lower levels of stress hormones, inflammation, and oxidative stress, which are all factors that can damage the kidneys. But they also had improved kidney function, lower blood pressure, and better quality of life. So, to protect your kidneys and your overall health, you have to start trying to reduce your stress levels. There are many things you can do, such as eating healthier foods, limiting salt and caffeine, exercising regularly, setting aside time to relax, getting enough sleep, talking to someone you trust, or seeking professional help if needed. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Eating too much sugar. Do you have a sweet tooth? Do you love to indulge in sugary treats and drinks? If so, you might want to think twice before reaching for that candy bar or soda. According to studies, when you have too much sugar in your blood, your kidneys have to work harder to get rid of it. This can cause clogging and damage to the tiny blood vessels in your kidneys and impair their function. Over time, this can lead to chronic kidney disease, which means your kidneys can't clean your blood properly. For example, in a recent study done in 2022, researchers found that participants who had more than 25% of their total calories from sugar had a 58% higher risk of developing kidney stones than those who had a low intake of sugar, which is less than 10% of their total calories. So, how much sugar is safe to eat per day? Well, according to the American Heart Association, men should consume no more than 9 teaspoons or 36 grams of added sugar per day. For women, the number is lower, 6 teaspoons or 25 grams per day. To put this in perspective, one 12-ounce can of soda contains about 8 teaspoons or 32 grams of added sugar. Number 5. Having poor hygiene practices. Did you know that your hygiene habits can affect your kidney health? Yes, you heard that right. Poor hygiene practices can increase the risk of urinary tract infections, which can damage your kidneys over time. The urinary tract is the system that filters and removes waste and excess fluid from your body. It includes the kidneys, bladder, ureters, and urethra. But sometimes bacteria can enter the urinary tract through the urethra and cause an infection. This can happen if you don't wipe properly after using the toilet, or if you don't wash your genitals regularly. These UTIs can cause a lot of discomfort, such as burning, itching, and pain when you pee. They can also spread to the kidneys and cause inflammation and scarring. This can reduce the kidney function and lead to chronic kidney disease. So, to protect your kidneys, try following these some simple hygiene tips. First, wipe from front to back after using the toilet. This prevents the bacteria from reaching your urethra and causing an infection. You also need to wash your genitals with mild soap and water every day. And finally, change your underwear and pads or tampons regularly. This prevents the growth of bacteria and yeast that can cause infections. Number 6. Drinking too much soda. I know, it's hard to resist the sweet and fizzy taste of these beverages, especially on a hot day. But unfortunately, soda is one of your kidney's worst enemies. First of all, soda contains a lot of sugar or high fructose corn syrup, which is even worse. Sugar can increase your blood pressure and cause inflammation in your body, both of which can damage your kidney function. High fructose corn syrup can also increase your uric acid levels, which can lead to kidney stones and gout. In a recent study done in 2016, researchers found that participants who drank 2 or more sugary sodas per day had a 40% higher risk of developing albuminuria, which is a condition where protein leaks into the urine, indicating kidney damage. Other than that, dark-colored sodas contain phosphoric acid, which is added to give them a tangy flavor and prevent the growth of mold and bacteria. Your kidneys help your body get rid of excess phosphorus naturally. But if you have chronic kidney disease, your kidneys may not be able to do this efficiently. This can lead to a condition called hyperphosphatemia, where you have too much phosphorus in your blood. Hyperphosphatemia can cause itching, bone pain, muscle cramps, and calcification of your blood vessels and organs, which can increase your risk of heart disease and stroke. So the best thing you can do is to drink less soda, or better yet, none at all. Number 7. Having vitamin D deficiency. First of all, you need to understand that vitamin D is not just a vitamin, but also a hormone. It helps your body absorb calcium and phosphate, which are essential for your bones and teeth. But it also has other roles, such as regulating your blood pressure, making red blood cells, and activating your immune system. And guess what? Your kidneys are responsible for converting the vitamin D you get from the sun or your diet into its active form, which your body can use. That's why your kidneys and vitamin D have a special relationship. When your body lacks vitamin D, your blood vessels can become stiff and narrow, which can increase your blood pressure and strain your kidneys. Other than that, your body also can't absorb enough calcium and phosphate, which can lead to bone loss, which also releases calcium into your blood, which can harm your kidneys. In a recent study done in 2020, researchers found that patients with chronic kidney disease who took vitamin D supplements had a lower risk of death and cardiovascular events than those who did not. So how much vitamin D do you need? Well, generally, healthy adults under the age of 70 need 600 international units, or 15 micrograms, of vitamin D each day, and those over 70 need 800 international units, or 20 micrograms. Number 8. Ignoring high blood pressure. High blood pressure is the force of blood pushing against your blood vessel walls. When this force is too high, it can narrow and weaken your blood vessels, including the ones in your kidneys. If your blood vessels are damaged, your kidneys may not work properly, and you may end up with too much fluid in your body. This can raise your blood pressure even more and create a vicious cycle. Over time, this can cause kidney failure, which means you need dialysis or a transplant to survive. But don't worry, one way to protect your kidneys is to take medications that lower your blood pressure. In a recent study done in 2022, researchers found that long-term use of drugs called angiotensin receptor blockers reduced the risk of kidney failure by about 30% in people with high blood pressure and kidney disease. You also need to make some lifestyle changes. You can eat a balanced diet, limit your salt intake, exercise regularly, quit smoking, and reduce stress. These simple steps can make a big difference in your blood pressure and your kidney function. Number 9. Exposure to contrast dye. Contrast dye is a substance that makes certain parts of your body show up better on imaging tests, such as CT scans or MRIs. But sometimes it can cause problems for your kidneys, especially if you already have kidney disease or other risk factors. Contrast dye can damage your kidneys by reducing the blood flow to them, or by causing inflammation and oxidative stress. This can lead to a condition called contrast-induced acute kidney injury, which means your kidneys stop working properly for a short time after the test. This condition can cause symptoms like swelling, fatigue, poor appetite, or dry skin. In some cases, it can lead to chronic kidney disease, dialysis, or even death. So, how common is contrast-induced acute kidney injury? Well, it depends on your kidney function and other factors, such as diabetes, heart disease, or dehydration. For most people, the risk of contrast-induced acute kidney injury is very low, less than 2%. But for people with advanced kidney disease, the risk can be as high as 40%. The best way to protect your kidneys is to drink plenty of fluids before and after the test, unless you have fluid restrictions. This will help flush out the contrast dye from your body and keep your kidneys hydrated. Another way to prevent this injury is to use the lowest possible dose of contrast dye, or avoid it altogether if possible. Some tests can be done without contrast dye, or with a different type of dye that is safer for your kidneys. So talk to your doctor about the best option for you. Number 10. Breathing polluted air. Did you know that the air you breathe can affect your kidneys? The air you breathe contains tiny particles called PM 2.5, which are smaller than the width of a human hair. These particles can enter your lungs and bloodstream and cause inflammation and damage to your organs, including your kidneys. In a recent study done in China, researchers found that after the implementation of the Clean Air Action Plan in 2013, which reduced PM 2.5 levels in the air, the kidney function of the population improved significantly. They estimated that each decrease of 10 micrograms per cubic meter in PM 2.5 was associated with an increase of 0.42 milliliters per minute per 1.73 square meters in the glomerular filtration rate, which is a measure of how well your kidneys are working. That means cleaner air can make your kidneys healthier and happier. So, what can you do to protect your kidneys from air pollution? Well, try to avoid outdoor activities when the air quality is poor. You can check the air quality index online or on your phone to see how polluted the air is in your area. You can also use an air purifier or a humidifier at home or at work to filter out the harmful particles from the air. So, these were the 10 daily habits that are damaging your kidneys and how to avoid them. Remember, your kidneys are vital organs that perform many functions for your health and well-being. So treat them well and don't take them for granted. Now, we want to hear from you. Do you have some of these habits? Did you know they were harming your kidneys before watching the video? Share with us your experiences and opinions in the comments below. We love to hear them. Kidney stones are hard deposits of minerals and salts that can form inside your kidneys and cause a lot of trouble. They are basically the result of having too much of certain substances in your urine, such as calcium, oxalate, uric acid, or cysteine. These substances can crystallize and stick together, forming small pebbles or larger rocks that can range from the size of a grain of sand to a golf ball. Normally, your urine contains enough fluid and chemicals to prevent these crystals from forming. But sometimes things can go wrong. For example, if you don't drink enough water, your urine can become more concentrated and acidic, creating the perfect environment for kidney stones to grow. Or if you have certain medical conditions or take certain medications or supplements that affect your urine composition, you might also be at higher risk of developing kidney stones. So how do you know if you have kidney stones? Well, the bad news is that kidney stones can be very painful and sometimes even dangerous. But the good news is that they usually have some early warning signs that can alert you to seek medical attention before it is too late. So in this video, we will reveal 8 early warning signs of kidney stones you should never ignore. And at the end, we will give some tips to prevent kidney stones from forming at the first place. So without further ado, let's get started. Number 1. Back or side pain below the ribs. This is the most common symptom of kidney stones. It usually starts as a dull ache that comes and goes, but it can become sharp and severe as the stone moves along the urinary tract. The pain can radiate to the lower abdomen and groin, and it can change in intensity and location as the stone moves. Number 2. constant urination. This is a sign that your bladder is irritated by the stone or by an infection. You might feel an urgent need to pee, even if you have just emptied your bladder. You might also pee more often than usual, but only in small amounts. Number 3. Pain during urination. This is another common symptom of kidney stones. It happens when the stone reaches the bladder or the urethra, which is the tube that carries urine out of the body. You might feel a burning sensation or a sharp pain when you try to pee. You might also have difficulty starting or stopping the urine flow. Number 4. Cloudy, pungent urine. This is a sign that there is an infection in your urinary tract, which can happen when the stone blocks the urine flow and allows bacteria to grow. Your urine might look cloudy or murky, and it might have a foul or strong smell. You might also have fever, chills, nausea, or vomiting. Number 5. Pink, red, or brown urine. This is a sign that there is blood in your urine, which can happen when the stone scratches or irritates the lining of the urinary tract. The color of your urine can vary depending on how much blood there is and how long it has been in contact with the urine. Sometimes you might not see any visible blood, but a urine test can detect it. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Unexplainable nausea and vomiting. This is a sign that your body is trying to cope with the pain and stress caused by the kidney stone. You might feel sick to your stomach or lose your appetite. You might also vomit because of the intense pain or because of an infection. Number 7. Troubles with urine flow. This is a sign that the stone is blocking or partially blocking the urine flow. You might have difficulty starting or maintaining a steady stream of urine. You might also feel pressure or fullness in your bladder or lower abdomen. Number 8. Fever and chills. This is a sign that you have a serious infection in your urinary tract, which can happen when the stone causes an obstruction or damages the tissue. You might have a high fever, above 38 degrees Celsius, chills, sweating, shivering, or shaking. So, these were the 8 early warning signs of kidney stones. If you have any of these signs or symptoms, don't ignore them, as kidney stones can cause serious complications if left untreated, such as kidney damage, sepsis, which is a life-threatening infection in the bloodstream, or hydronephrosis, which is swelling of the kidney due to urine buildup. You should see a doctor as soon as possible to get a proper diagnosis and treatment. Your doctor will ask you about your symptoms, medical history, and diet. You may also need to do some tests like blood tests and urine tests to confirm the diagnosis and determine the type and size of the stone. The treatment for kidney stones depends on their size, location, and composition. Some kidney stones can pass on their own with plenty of fluids and pain medication. Others may require medication to help them dissolve or break up into smaller pieces, and some may require surgery to break and remove them. Now let's talk about prevention. The first and most important tip is to drink enough water. Water helps dilute the substances in your urine that can form kidney stones. How much water should you drink? Well, it depends on your body weight, activity level, climate, and diet. But a general rule of thumb is to drink at least 2 liters of water per day. If you have a history of kidney stones, you may need to drink more. You can check the color of your urine to see if you are hydrated enough. It should be clear or pale yellow. If it is dark yellow or brown, you need to drink more water. Another tip is to limit your intake of animal protein, sodium, and oxalate. Animal protein, such as meat, eggs, and dairy products, can increase the amount of uric acid and calcium in your urine, which can promote kidney stone formation. Sodium or salt can also increase the amount of calcium in your urine. And finally, oxalate is a compound found in some foods, such as spinach, rhubarb, nuts, chocolate, and tea. It can bind with calcium in your urine and form calcium oxalate stones, which is the most common type of kidney stones. You don't have to avoid these foods completely, but you should eat them in moderation and balance them with foods that are low in oxalate and high in calcium. Yes, You heard that right. Calcium is actually good for preventing kidney stones as long as you get it from food sources and not supplements. Calcium from food can bind with oxalate in your intestines and prevent it from entering your urine. However, calcium supplements can increase the risk of kidney stones by raising the level of calcium in your urine without affecting the level of oxalate. So make sure to get enough calcium from foods like milk, yogurt, cheese, broccoli, kale, and almonds. One more tip is to drink some citrus juices, such as lemonade or orange juice. These juices contain citrate, which can stop crystals from turning into stones by making the urine less acidic and preventing the growth of bacteria that can cause infections. Studies have shown that drinking about half a liter of lemonade or orange juice per day can reduce the risk of kidney stones by up to 12%. However, be careful not to drink too much juice or add too much sugar, as this can increase your calorie intake and cause weight gain. So, these were some simple but effective ways to prevent kidney stones according to studies. Of course, if you have any symptoms or concerns about kidney stones, you should consult your doctor for diagnosis and treatment. Remember that prevention is better than cure, so drink plenty of water, eat a balanced diet, and enjoy some citrus juices every day. Now we want to hear from you. Did you have some of these symptoms before? Was it actually a kidney stone? Share with us your experiences and opinions in the comments below. We love to hear them. Your kidneys are two bean-shaped organs that are located on either side of your spine, just below your rib cage. They are responsible for filtering your blood and removing waste products and toxins from your body. They also help regulate your blood pressure and produce hormones that affect many aspects of your health. In a nutshell, they work very hard to keep you healthy. But they can also be vulnerable to damage from various factors, such as toxins overload, diabetes, high blood pressure, infections, kidney stones, and certain medications. If left untreated, kidney damage can lead to chronic kidney disease, which is a condition where the kidneys lose their ability to function properly over time. That's why it's important to take good care of your kidneys to prevent chronic kidney disease or stop its progression if you already have it. One way to take good care of your kidneys is by drinking some specific herbal teas that have beneficial effects on your kidney health. In this video, we will reveal the top 6 herbal teas for your kidney health according to research. These special teas can cleanse your kidneys from toxins, prevent or dissolve kidney stones, and improve your kidney function. So, without further ado, let's get started. Number 1. Hydrangea tea. Hydrangea tea is an herbal infusion made from the roots or leaves of the hydrangea plant. It has been used for centuries by Native Americans to treat kidney and bladder problems. But how does it work and what are its benefits? Well, hydrangea tea is a natural diuretic, which means it makes you pee more. This helps flush out waste and excess fluids from your body, reducing water retention and improving your kidney's filtering rate. Other than that, hydrangea tea works by affecting several enzymes and molecules that are involved in kidney health. One of them is xanthine oxidase, which produces uric acid, which is a substance that can form kidney stones. Hydrangea tea inhibits xanthine oxidase and reduces uric acid levels in the blood and urine. Another one is nitric oxide, which is a molecule that regulates blood flow and inflammation. Hydrangea tea reduces nitric oxide production and prevents inflammation and damage in the kidneys. For example, one study found that hydrangea root extract reduced the size and number of kidney stones in rats by 60% and 50% respectively. Another study found that hydrangea leaf extract reduced uric acid levels by 25% and nitric oxide levels by 40% in mice with gout. These studies suggest that hydrangea tea can help prevent and treat kidney stones, gout, and other kidney disorders. If you want to try hydrangea tea, you can buy it online or in health food stores. You can also make your own by boiling some dried hydrangea roots or leaves in water for about 15 minutes. Strain the liquid and enjoy. You can add some honey or lemon juice for extra flavor. Number 2. Sambong tea. Sambong tea is a tea made from the leaves of the sambong plant native to the Philippines and other parts of Asia. It is not only delicious, but also has many health benefits, especially for your kidneys. First of all, sambong tea can help dissolve kidney stones, which are hard deposits of minerals and salts that form in your urinary tract and can cause severe pain and blockage. Sambong tea contains phytochemicals called terpenes, which are also found in some drugs for kidney stones. These terpenes can break down the crystals and prevent them from sticking together. One study found that sambong extract decreased the size of calcium oxalate crystals, one of the most common types of kidney stones, by 27%. Sambong tea can also delay or prevent renal failure, which is a serious condition where your kidneys stop working properly and cannot filter your blood. This is because sambong tea can protect your kidneys from damage by lowering your blood sugar and blood pressure levels, fighting bacteria and fungi that cause infections, and reducing inflammation and oxidative stress in your kidney tissues. So, how to prepare and drink sambong tea? Well, here are the steps to follow. First of all, boil some water in a pot or kettle, then wash and chop some fresh sambong leaves or use dried ones. Put the leaves in a teapot or cup and pour the boiling water over them. Cover the teapot or cup and let it steep for 10 to 15 minutes. Finally, strain the tea and enjoy it hot or cold. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Ginger tea. Ginger is a spice that has been used for centuries for its medicinal properties. It can help with nausea, pain relief, digestion, and blood sugar control. But did you know that ginger can also protect your kidneys from damage and disease? According to some studies, ginger can reduce inflammation in the kidneys caused by various health conditions, such as diabetes, obesity, hypertension, and metal toxicity. Inflammation is one of the main factors that can lead to kidney damage and failure. By reducing inflammation, ginger can help preserve your kidney function and prevent complications. One study found that ginger extract reduced kidney inflammation and oxidative stress in rats with diabetes. Another study found that ginger protected the kidneys of rats from lead-induced toxicity. A third study found that ginger prevented kidney damage in rats fed with a high fructose diet. So, how does ginger work its magic on the kidneys? Well, ginger contains several active compounds, such as gingerols and shogols, that have anti-inflammatory, antioxidant, and antifibrotic effects. These compounds can affect the activity of various enzymes and molecules that are involved in kidney inflammation and fibrosis. So how can you enjoy the benefits of ginger tea for your kidneys? You can make your own ginger tea by boiling fresh or dried ginger slices in water for about 10 minutes. You can add some lemon juice or honey for extra flavor and health benefits. You can also buy ready-made ginger tea bags or powder from the store. Number 4. Unsweetened green tea. Green tea is a type of tea that is made from the leaves of the Camellia sinensis plant, which is also used to make black tea and oolong tea. The difference is that green tea leaves are not fermented or oxidized, unlike black and oolong teas. This means that green tea retains more of its natural antioxidants and polyphenols, which are compounds that have anti-inflammatory, anti-cancer, and anti-aging effects. So how does green tea benefit your kidneys? First of all, green tea can help prevent kidney stones by reducing the amount of oxalate in your urine, which is one of the main components of kidney stones. Green tea also increases the amount of citrate in your urine, which helps dissolve kidney stones. A study from China found that drinking more than 240 milliliters of green tea per day reduced the risk of kidney stones by 14%. Other than that, green tea can also protect your kidneys from damage caused by toxins, inflammation, or oxidative stress, as it contains catechins, which are antioxidants that can scavenge free radicals and reduce inflammation. Green tea also has antibacterial and antiviral properties that can prevent infections in your kidneys. A study from Japan found that drinking green tea was associated with a lower risk of end-stage renal disease, which is the final stage of chronic kidney disease. Number 5. Dandelion tea. Dandelion tea is made from the roots, leaves, or flowers of the dandelion plant, which grows widely in many parts of the world. It has been used for centuries in traditional medicine as a diuretic, meaning that it helps increase urine output and flush out excess water and toxins from your body. This can be beneficial for your kidneys because it can help prevent or reduce fluid retention, swelling, kidney stones, and urinary tract infections. But that's not all. Dandelion tea is also a great source of antioxidants that work to neutralize the free radicals in your body. Free radicals are unstable molecules that can cause oxidative stress and damage your cells and tissues, including your kidneys. Antioxidants can protect your kidneys from oxidative stress and inflammation, which are associated with kidney disease. Making dandelion tea is also very easy and simple. You just need some fresh or dry dandelion parts, roots, leaves, or flowers, and some water. Just make sure to consult your doctor before drinking dandelion tea, as it contains potassium. Number 6. Parsley tea. Parsley tea is a natural, homemade drink that you can easily prepare with fresh or dried parsley leaves. It helps cleanse your kidneys by increasing urine production and flow, which may push out kidney stones. It's also said to prevent the absorption of salt into kidney tissue, preventing the formation of kidney stones. According to one study, treating rats with parsley helped increase urine volume, decrease amount of calcium in urine, and raise the acidity of urine, which all helps prevent kidney stones. Parsley also contains compounds called flavonoids and apiol that stimulate the kidneys to eliminate excess fluids from the body. This can help reduce edema, bloating, and water retention. And finally, parsley is rich in antioxidants, vitamins, and minerals that help fight oxidative stress and inflammation in the kidney tissues. So there you have it. These were the top 6 herbal teas that can detox your kidneys according to studies. At the end, remember that these teas are not a substitute for a healthy diet and lifestyle, but rather a complement to them. You should also consult your doctor before trying any new herbal remedies, especially if you have any existing medical conditions or are taking any medications. Now, we want to hear from you. Did you try some of these teas before? Did you experience some of these benefits? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching. Your kidneys are amazing vital organs that perform many functions in your body, such as filtering waste products from your blood, balancing fluids, regulating blood pressure, and eliminating drugs. However, sometimes they can get damaged or overloaded with toxins due to various factors, such as dehydration, infections, diabetes, high blood pressure, kidney stones, or exposure to environmental pollutants. What you may not know here is that what you drink can significantly impact your kidney health, not just what you eat. Some drinks you may be drinking every day could be straining your kidneys, damaging their blood vessels, and increasing the risk of kidney stones and other kidney diseases. So in this video, we will reveal the worst 6 drinks for your kidney health. So, without further ado, let's get started. Number 1. High-sodium sports drinks. Do you love to chug down a bottle of your favorite sports drink after an intense workout or a game? You might think you're doing your body a favor by replenishing those lost electrolytes, but you could also be putting your kidneys at risk. Electrolytes are essential minerals that help balance your body's fluids and electrical signals. They include sodium, potassium, magnesium, and others. You lose some of these electrolytes when you sweat, and that's why sports drinks are designed to replace them quickly. But here's the catch. Many sports drinks also contain a lot of sodium. Sodium is important for regulating your blood pressure and fluid balance, but too much of it can cause problems, especially if you have kidney disease or are at risk of developing it. According to the National Kidney Foundation, high sodium intake can increase your blood pressure, which puts more strain on your kidneys. Over time, this can damage your kidney function and lead to chronic kidney disease. A study involving 12,126 participants in the general population without chronic kidney disease found that high salt intake could predict future kidney impairment. While it's natural for kidney function to slow with age, the study results suggest that a high salt diet can accelerate this decline. So how much sodium is too much? The American Heart Association recommends limiting your sodium intake to no more than 2,300 milligrams per day, and ideally to 1,500 milligrams per day. To put that in perspective, 1 teaspoon of salt contains about 2,300 milligrams of sodium. Now let's look at some popular sports drinks and see how much sodium they have per serving. Number 1. Gatorade Thirst Quencher, 160 milligrams. Number 2. Powerade, 150 milligrams. Number 3. Gatorade Endurance Formula, 310 milligrams. As you can see, some sports drinks have more sodium than others. Gatorade Endurance Formula, for example, has more than 10% of your daily sodium limit in one serving. That's because it's designed for athletes who sweat a lot and need more sodium to prevent hyponatremia, which is a condition where your blood sodium level becomes too low. But if you're not an endurance athlete or exercising in extreme conditions, you probably don't need that much sodium. In fact, drinking too much of these high-sodium sports drinks could actually dehydrate you more by making you thirsty and retaining water in your body, which strains your kidneys and puts extra load on them. So what should you drink instead? Well, it depends on how long and how hard you exercise. If you're working out for an hour or less with moderate intensity under normal weather conditions, water is typically all you need to rehydrate. If you're exercising for longer than an hour or at a high intensity, or in hot and humid weather, you might benefit from a sports drink that has some electrolytes and carbohydrates to replenish your energy and prevent cramps. Number 2. Soda. Do you know what your favorite fizzy drink is doing to your kidneys? You might want to think twice before reaching for that can of cola. One of the main reasons why soda is bad for your kidneys is because of phosphoric acid. Phosphoric acid is a colorless, odorless, and corrosive liquid that gives soda its tangy flavor and prevents mold and bacteria growth. Phosphoric acid is made from the mineral phosphorus, which is naturally found in the body and works with calcium to support bone health, kidney function, and energy metabolism. However, too much phosphorus in the body can be very harmful, especially for people with kidney disease. High amounts of phosphoric acid can lead to kidney damage and eventually kidney failure. A study was conducted to examine the connection between carbonated beverages, including cola, and chronic kidney disease. They found that drinking 2 or more colas each day was linked to a significantly higher risk of chronic kidney disease compared to non-cola carbonated drinks. Another reason why soda is bad for your kidneys is because of high fructose corn syrup. High fructose corn syrup is a type of sugar that is widely used in sodas and other processed foods. This corn syrup can raise your blood sugar levels and cause insulin resistance, which can lead to type 2 diabetes and diabetic kidney disease. According to a study published in 2010, the high amount of corn syrup in soda was found to be the reason behind elevated uric acid levels. These elevated levels of this acid push your kidneys to work much harder. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe, and hit the bell icon so you don't miss more videos like this. Number 3. Diet soda. You may think that diet sodas are better, but that is not the case. Diet sodas contain artificial sweeteners such as aspartame, sucralose, and saccharin, which have many negative effects on your health. Aspartame especially is broken down into several chemicals in the body, some of which may have toxic effects on the kidneys. According to an 11-year study by scientists at the Brigham and Women's Hospital in Boston, found that women who drank more than 2 servings of diet soda per day had a 30% greater reduction in kidney function compared with women who did not drink diet soda. Another study by researchers at Loyola University Chicago found that people who drank more than 7 glasses of diet soft drinks per week had an 83% higher risk of end-stage renal disease compared with those who drank less than 1 glass per week. These studies suggest that drinking diet soda may not be worth the risk for your kidneys. So what can you do to protect your kidneys from soda damage? Well, the best thing you can do is to limit or avoid soda altogether and drink water or other healthier beverages instead. Water is essential for keeping your kidneys healthy and hydrated, and it can also help prevent kidney stones and infections. If you find it hard to quit soda cold turkey, you can try some healthier alternatives such as sparkling water, unsweetened herbal teas, coffee, or smoothies. You can watch our video on the best drinks for your kidneys if you want to learn more about them. Number 4. Energy drinks. Energy drinks are very popular among young people, athletes, and busy professionals who need a quick pick-me-up. But are they really good for your kidneys? Well, it turns out that energy drinks can have some serious negative effects on your kidneys and overall health, and one of the main reasons is an amino acid called taurine. Taurine is an amino acid that is naturally produced by our bodies and found in foods like meat, seafood, and dairy. It helps regulate hydration, digestion, nerve growth, and mineral balance. However, according to several studies, when taurine is consumed in excess, it can harm your kidneys by interfering with their ability to filter waste products from your blood. Taurine is normally excreted by your kidneys in small amounts, but when you consume too much of it, it can accumulate in your blood and cause toxicity. This can lead to symptoms like nausea, vomiting, headache, dizziness, and even seizures. Another way that energy drinks can harm your kidneys is by increasing the risk of kidney stones. Kidney stones are hard deposits of minerals and salts that form in your urinary tract. One of the main factors that contribute to kidney stone formation is high urine calcium. The more calcium you have in your urine, the more likely you are to form stones. So, what does this have to do with energy drinks? Well, energy drinks have a lot of sodium, which makes your kidneys excrete more calcium into your urine. And the more calcium you have in your urine, the more likely you are to form stones. So how much is too much to drink? Well, some experts recommend not exceeding 116 ounces drink per day. And if you already have kidney disease, consult your doctor first. Number 5. Fruit juices. First of all, let me clarify that we're not talking about all juices. Some juices are actually good for the kidneys, such as cranberry juice, which can help prevent urinary tract infections and kidney stones. We're also not talking about moderate consumption of juice, which is usually fine for most people. I am talking about excessive or extreme juicing. The reason why juicing can harm the kidneys is the high sugar content of many juices. Even 100% fruit juice has a lot of natural sugar in it, which can raise blood glucose levels and increase the risk of diabetes. Diabetes is one of the leading causes of chronic kidney disease, which affects about 15% of U.S. adults. Several studies have found that people who drank sugar-sweetened drinks had significantly higher rates of chronic kidney disease than those who rarely drank sugary beverages. So, if you do drink juice, limit your portion to 4 fluid ounces or half a cup per day, and avoid juices that are high in oxalates and sugar, such as orange juice, avocado juice, beet juice, or tomato juice. Number 6. Alcohol. Alcohol is one of the worst drinks for your overall health, not just your kidneys. Alcohol puts extra stress on your kidneys and makes them less able to filter your blood. It also dehydrates your body, which affects the normal function of cells and organs, including the kidneys. When your kidneys are dehydrated, they can't keep the right amount of water in your body, and they have to work harder to get rid of the alcohol. One of the most serious effects of alcohol on the kidneys is acute kidney injury. This is when your kidneys suddenly stop working because of too much alcohol in your blood. This can happen when you binge drink, which means having 5 or more drinks in a short period of time. Acute kidney injury can be life-threatening and may require dialysis to remove the toxins from your blood. Another way alcohol can harm your kidneys is by increasing the risk of high blood pressure and diabetes. These are the two most common causes of chronic kidney disease in the U.S. High blood pressure damages the blood vessels in your kidneys and reduces their ability to filter blood. Diabetes affects the blood sugar levels in your body and can damage the nerves and blood vessels in your kidneys. So, how much alcohol is too much? Well, in general, experts recommend that women should have no more than 1 drink per day, and men should have no more than 2 drinks per day. Of course, some people should not drink at all, such as pregnant women, people with liver or kidney disease, people who take medications that interact with alcohol, or people who have a history of alcohol abuse or addiction. So, these were the worst 6 drinks for your kidneys. At the end, remember that moderation is key. You can still enjoy these drinks, but in moderation. But if you already have kidney disease or not sure if it is safe to drink any of them, talk with your doctor or dietitian. Now, we want to hear from you. Do you drink some of these drinks regularly? Did you know they were harmful to your kidneys before watching the video? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.